Okay, in this video we will be discussing about the management of complications. Okay, we have already discussed about the management. Now we will be discussing about the management of complications. What are the complications that can arise and how we can manage? Okay, we have already discussed. We have also already discussed about the complications, various types of complications. Okay, first acute renal failure. Acute renal failure. How acute renal failure can be managed? Okay, first acute renal failure can be managed by fluid administration. Okay, first fluid is administered so that we can assure that there is adequate hydration. Okay, but if the plasma level of blood urea nitrogen or the creatinine rise despite adequate rehydration, then fluid administration should be stopped. Okay, fluid administration restricted. Why? Because excessive fluid administration can lead to the volume overload. Okay, volume overload, and it will lead to the pulmonary edema. So to prevent volume overload, hemofiltration or hemodialysis should be done as soon as possible. Hemofiltration or hemodialysis should be done as soon as possible. And hemofiltration, hemodialysis is preferred over the peritoneal dialysis. Okay, for acute renal failure, main is the hemofiltration or hemodialysis, which should be done as soon as possible. Second is acute pulmonary edema. How we can manage the acute pulmonary edema? The acute pulmonary edema caused by the malaria is managed in the similar pattern as the pulmonary edemas caused by other etiologies. Okay, so what should be done? First, repositioning of the head. Repositioned head with 45-degree elevation. First, second is oxygen therapy, and third is IV diuretics, and sometimes positive pressure ventilation can be done. Okay, third is the management of hypoglycemia. Hypoglycemia can be managed by dextrose. Okay, initial slow injection of 20% of dextrose, that is 2 mg per kg over 10 minutes, followed by infusion of 10% of dextrose, followed by infusion of 10% of dextrose, 0.1 gram per kg per hour. Okay, and glucose level should be checked regularly. Fourth is sepsis. Okay, if the patient is receiving the anti-malaria treatment, but the condition gets worsened, then there can be two possibilities. Okay, one is due to hypoglycemia, second is due to sepsis. We have already discussed that the sepsis in the case of the malaria is caused by mainly by Salmonella species, and the antibiotics covering these species should be used. Okay, but in those areas, in endemic areas where it is difficult to distinguish that the symptoms are caused by the severe malaria or it is caused from the bacterial sepsis. Sometimes it becomes difficult to distinguish between the severe malaria and the bacterial sepsis. In these conditions, we should treat with both antibiotics and anti-malaria drugs. In these cases, we should treat for both bacterial sepsis by antibiotics and for severe malaria by anti-malaria drugs. Okay. Very important point to remember is antibiotics will always be considered in the patient who are severely ill and who are not responding to the anti-malaria drugs. Okay, anti-malaria drugs who are not responding to anti-malaria drugs, not responding, then we should always consider antibiotics for severely ill patient. Okay. Fifth is the management of other complications. Like spontaneous bleeding. Spontaneous bleeding can be managed by fresh blood and IV vitamin K. Second is convulsions. Convulsions can be managed by IV or rectal benzodiazepines. And respiratory support. And sometimes there can be aspiration pneumonia. Mainly in case of unconscious patient. This aspiration pneumonia can be managed by IV antimicrobials, oxygen therapy, and pulmonary toileting. Thank you.